Yesterday, I successfully performed the surgery for a very unfortunate boy with a severe chest wall deformity. The patient was a 17-year-old boy. He suffered from severe chest wall deformity and severe malnutrition. He was only 148 centimeters tall and weighed only 20 kilograms. His condition was very critical and required emergency surgery. He is from Wenzhou, Zhejiang Province, more than 1,000 kilometers away from Guangzhou. He was taken to my hospital by ambulance a few days ago. The patient's illness began at the age of 2. He contracted leukemia at the time and underwent bone marrow transplant at a local hospital, after which his physical development became retarded and significantly slower than that of children of the same age. His chest wall was particularly sluggish in its development, significantly lower than the rest of his body. From the age of 10, he was found to have deformity in his chest wall, with a second chest wall on his right side and a coarctation of the entire chest wall. His breathing was affected and his movement was restricted. He continued to grow in age, but his height and weight did not increase significantly, while his deformity continued to worsen. A month ago, he developed severe breathing difficulties and had to be resuscitated at a local hospital, but his symptoms never resolved. In order to treat the disease thoroughly, he was transferred to our hospital in an emergency way. Physical examination on admission showed that the patient had severe stunting, short stature, extreme emaciation, a height of 148 centimeters, and weight of 20 kilograms. His chest wall was severely deformed with overall coarctation and depression on the right side and a pronounced heartbeat on the left chest wall. Imaging examination showed coarctation of the chest wall, depression of the right chest wall, asymmetry between the left and the right sides, the heart blockade in the left chest cavity, severe compression of the left lung, and dysplasia. The patient had a clear diagnosis. He was in a critical condition and surgery was indicated. After adequate preoperative preparation, the surgery was performed under general anesthesia. Longitudinal incisions were made in both chest walls to impose the costal cartilage and ribs. The third, fourth, fifth, sixth rib were cut off at the junction of the costal cartilage, and the anterior chest wall was supported as a whole by one procedure, and then the severed rib and the costal cartilage were connected with metric rib, and the chest wall was reconstructed to expand the thoracic volume. The operation went smoothly without any complication and ended in 2 hours. After the surgery, the deformity of the chest wall disappeared and thoracic capacity was significantly expanded. The patient's vital indicators were also close to normal. The surgery was completed successfully. This patient was severely stunned and malformed, and the surgical risk was extremely high, and the operation was extraordinarily difficult. Since the chest wall compressed the heart and lungs, seriously affecting the cardiopulmonary function, surgery was his only option. That is a life-saving operation, so it must be done as soon as possible. Yesterday's surgery was extremely important. Why? The deformity ruined the child's life and caused him and the family great pain. My work relieves the suffering of the patient. I felt very honored to be the doctor who performed the surgery on him. I'm Dr. Wang from China.